Thank you. I actually feel like I should be thanking you for the privilege to be here. And I would like to start out by acknowledging and thanking Nancy Wilson and Randy Kirk for being so instrumental in bringing me here. I'm truly honored to be here to help you initiate your Humanity in Medicine Week. My dad, may his soul rest in heaven, would be very proud today. I grew up in New Orleans, Louisiana, with a physician father whom I idolized and never had quite enough time with. When he passed away suddenly in 1986, after 50 years of the practice of internal medicine at a hospital called Touro Infirmary in New Orleans, Louisiana, I see a lady sort of nodding her head a little bit back there, we created an award in honor of his name called the Compassionate Physician Award. It is an award given annually to the Tulane University medical student who is graduating, who most epitomizes what my father stood for, which was compassion and empathy and caring for the patient as a whole. So I thank you for the opportunity to be here, and I want to share another story with you, if I might, which is one of my favorite books of all times, is a book called Zen and the Art of Motorcycle Maintenance. And it is by a gentleman named Robert Pirsig. And it is really the story of a father who goes on a Chautauqua, on a journey with his son on the back of a motorcycle and travels around the United States. And what struck me, and this wasn't prepared, this sort of struck me this evening, was he talks about how it's important for the maintenance of a motorcycle. Sometimes you have to take it to a shop, you have to take it to a garage. He said you can walk into a garage, and the moment you walk into that service station, you have a sense for whether it's a quality place or not. Now, I will tell you, I walked into your hospital here and immediately got the sense that that you have a quality place here. It's very clear to me your leadership is among the best, and I've traveled around to hospitals around the country. Your leadership is among the best, and you, as a team, is among the best of any that I've seen as I've traveled. So you have a lot to be proud of. And therefore, I really thank you for having the opportunity to be here and share with you. As I've traveled around the United States, what I've seen is that these are not easy times in healthcare. In fact, few are happy. Not patients, not healthcare providers, not insurers. And somehow, so much has gotten in the way of the people-to-people and human connection, which is so important in the healing process. And not only that, but many of us have forgotten or lost touch with what brought us to be in healthcare in the first place. And so that's why I want to talk with you tonight about the title of my talk, which is, can we put that on? Astonishing our patients, astonishing ourselves. So what I would like to ask you to do is to consider these three questions. Number one, why try? Number two, how can we make it happen? Oops, my mouse is moving around here. Maybe I'll leave it here for right now. How can we make it happen? And number three, what happens when we do? And my hope is at the end of this evening, the end of our time together, first of all, you'll have a good sense of the answers to those questions. Second of all, you'll have a sense that you are all well on your way. And third, you will reconnect to the gifts that each of you have to give in terms of your personal and your professional lives. Now, I have to thank Randy for introducing me. A lot of times when they introduce speakers, they say he's an assistant clinical professor of emergency medicine at Mount Sinai School of Medicine, and he wears this hat, and he wears this hat. And the hat that's really most important to me is this hat. This is my family, my beautiful wife, Amber, my youngest daughter, Julia, my middle daughter, Chelsea, and my eldest daughter, Mia, 9, 11, and 14. And they constantly remind me about what's important in life and about the importance of balance And actually, Dad's not home tonight helping them with their homework. So I have to thank and appreciate them for allowing me to travel and share with you what my experience is, whatever I have to offer. See if we can do this without this mouse moving around too much. I'm going to ask you, and I'm going to try to stay out of your way here a little bit, I'm going to ask you to consider whatever it is that you do as a small business. Now, I want you to understand, I told you about my dad. When they asked me, my third year in medical school, you go to the associate dean and you're asked, what kind of doctor do you want to be? And I got asked what kind of doctor I wanted to be, and I told them I want to be a people doctor. And they weren't quite happy with that. And but this is a people doctor. I know there may be some MBAs in the audience. I'm not an MBA. In fact, I've never taken a business course in my life. What I'm talking about here, when I talk about looking at what you do, whether it be your practice or your work or whatever, I'm going to ask you to think about it as a small business from a service perspective, not from a bottom line perspective. And what I mean by that is this. We get so busy doing it, getting the job done, that we don't stand back and sort of look from a distance and ask ourselves, are we producing the product that we'd like to produce? That little boy, he has to make sure that his lemonade tastes good, doesn't he? He wants people to come back. The problem is in healthcare, see, is that we've never had to worry about whether our product tastes good or not. All right? Well, guess what? Now we do. That's why we want to talk about astonishing our patients and at the same time astonishing ourselves. Now, in that regard, I'm going to ask you to have a little bit of double vision. And for those of you with healthcare backgrounds, I call it schizophrenic diplopia. Schizophrenia is being in two different realities at one time, and diplopia is double vision. We need to be in two different realities and have double vision in each. On the one hand, we need to look at process. If, in fact, we're going to look at what we do from a service perspective and the product that we're producing, we need to look at systems. Deming said 85% of problems are due to system problems. Correct the system and individual performance will improve. I believe that. The problem is that these days 85% isn't enough. And not only that, who is it that runs the systems? Us, people. So you have to focus on that 15%. So we need to focus on systems. We also need to focus on people. Now, we not only have to look, however, at process, we also need to look at what are we producing. We need to look at outcomes. And in healthcare, sometimes we're used to looking at outcomes in terms of mortality rates, in terms of returns to the OR, those kinds of things. And I'm going to suggest that in this environment, we need to look at other things. And we will talk more about this. We need to look at value-added services. We need to look at what is going to make us different than the guy down the street. Now, I understand that that there is no guy down the street with respect to a hospital down the street. However, as you're looking to grow and create an open heart program, which I think is hopefully going to open beginning of 2003, right? Number one, you are going to grow, and I have never seen a hospital board or CEO that doesn't think that growth is a good thing. The question is how you're going to grow. You're going to get a reputation. So not only are people in the surrounding counties going to want to come to you, but people from either further away are going to want to come to you because they know that the care that you give is second to none. So it's important in terms of patients. The single biggest retarding factor in terms of growth, in terms of good health care these days, is not patients. It's having the staff to care for them. So not only do we have to create a great place for patients to come, we have to create a great place for staff to work. And that's all of us, members of the board, members of the medical staff. We all don't know how important we are in terms of creating that environment. We are playing a game. Now, sports is very popular in our culture, and so I like to liken this to sports, which is in healthcare these days we are playing a game where the rules of the game are constantly changing. You go off the field at halftime, you come back on, they may have changed the game. They can change the rules even when you're on the field, and where for the first time we can't be sure we're going to have a place on the team. Now, I don't know how many of you remember back to junior high school where they would pick a captain and then you'd stand there and you'd hope that you'd get picked early, but sometimes you weren't picked at all. Well, you know what? We're sort of in that place right now in healthcare. Hospitals are closing. Even hospitals in rural areas that have nobody else around, without the kind of leadership and management that you have, are not doing well and run the risk of closing. Those kinds of things. In medicine, when I went into medicine, there was a sense that there was a golden parachute. I had a golden parachute. There was never the sense that doctors could go bankrupt, or hospitals or medical groups could go bankrupt, or anything like that. Well, the times have changed. We don't want to get into this situation. CABG stands for coronary artery bypass graft, by the way. And Tom Peters said this, and I do believe this firmly: you can never rest. You see, if the other guy's getting better, then you better be getting better faster than that other guy's getting better, or you're getting worse. Which means any of us who think that we can put our personal or professional car in park for 5 minutes these days is foolish. We can't do it. And we're going to talk about that. Do you feel like this? As you may be aware in this presentation, I love graphics. I try not to have a whole lot of words because I find that people don't remember words, but they do remember images. It touches us a little bit more. So sometimes I'll scour magazines for images. But I think this is how we feel. You know, in healthcare, particularly these days, they're focusing on our defects rather than on the gifts that we have to share with the Institute of Medicine report and all the rest. You know, do you know that you can go to www.healthgrades.com and find out how your hospital is ranked? And other people can do that as well, and people make healthcare decisions on the basis of what they see on the internet. So we're in that situation. Sometimes in healthcare we have a tendency to think that it's just us. You know, that in healthcare we feel beleaguered and all the rest. The truth is it's not. This came from USA Today. And it says how Americans feel about their lives. 68% of us feel that we need more fun. 67% need a long vacation. 66% often feel stressed. 60% feel time is crunched. Half of us want less work and more play. Half of us feel pressure to succeed, and almost half of us feel overwhelmed. So it's not just in healthcare. It's a pandemic in our culture. This is how we need to feel. Hazardous water, yes, we are on hazardous water now. But it would be awfully nice to have a sense that we are part of a team. We are part of a team. We are all working together to stay afloat. And not only that, maybe we can have a little bit of fun while we're at it. So I like to keep this image in my mind as we go through change. We can't afford this. We have to work together. And we can't afford that either. And we're quite good at that, at this, in healthcare. Business theory says that a competitive advantage can only be gained on the basis of one of two things. Either cost, that is, you are so low cost like a Walmart that everyone will want to come to you, or you are so high something like a Tiffany that everyone will want to come to you. Anywhere in between is Death Valley. So I would ask you, as members, you know, as folks who are vital to the leadership of Reed Hospital and healthcare system, how do you want to differentiate yourself? I don't know many hospitals and health systems that want to differentiate themselves as being low cost. So what are we going to do? Now the problem is this. What we're used to thinking of as quality is now taken for granted. When I was in medical school, quality was making the right diagnosis. And the problem is these days that will sort of get you in the game. You have to have a certain level of quality to even be considered. It won't have people pick you, choose you.